Patellar tendinitis is a term used to describe pain on the patellar tendon right underneath the kneecap. However, it should be noted that the term tendinitis is a bit of an outdated piece of terminology for this type of pain because it insinuates that an active inflammatory process is the main driver of this type of pain. And due to current research, we now know that this actually isn't all that true. Because of that, the best term for this, and the one that we're going to use, is patellar tendinopathy. Patellar tendinopathy is a type of overuse injury of the patellar tendon in which the demands that you place upon the tendon exceed that which it can handle, and it becomes aggravated and painful with things such as squatting, running, jumping, or even everyday tasks such as prolonged walking or stair climbing. An important thing to note with patellar tendinopathy is that when you're dealing with this issue, the patellar tendon can become sensitive not only to the amount of load or stress that you're placing upon it, but also the rate or speed with which you place that load upon the tissue. Let's use squats as a way to explain this a little bit better. When dealing with patellar tendinopathy, we would expect squatting with 225 pounds to be more painful than squatting with 135 pounds because the amount of overall load on the patellar tendon is higher with 225 pounds. We would also expect that squatting 135 pounds with a rapid descent and a bounce out of the bottom of the squat would be more painful than using a more controlled eccentric and a pause in the bottom because the rate or speed of the movement is higher. Luckily, we can use this concept to come up with an effective treatment plan for patellar tendinopathy and as an effective way to modify your training so you can continue doing things that you love while dealing with this injury. Now, let's outline the three-step process to fixing patellar tendinopathy. Step one is going to be modifying the painful activities. The two main ways to modify painful activities when dealing with this injury are to, one, reduce the overall load that the knee and the patellar tendon experience during these activities, and two, to modify the speed or rate of loading during these activities. Let's use squats as an example again. To reduce the amount or rate of loading on the knee and the patellar tendon, you could do things such as simply taking weight off the bar, changing the mechanics of the squat so you squat with a more hinge dominant movement pattern and allow less forward knee travel, squat to a partial range of motion, or we can use pauses or slower tempos to both reduce the amount of loading and the rate of loading. The goal of modifying these activities is to find ways to still do these movements but with a comfortable amount of symptoms or discomfort during the actual exercise themselves. Generally speaking, we recommend trying to keep discomfort during activity or during exercise to a 3 or 5 out of 10 at most. Step number 2 is directly improving the strength and load tolerance of the patellar tendon and the quadriceps as a whole. In our clinic, we typically use a very specific progression of exercises to achieve this in the most effective and time-efficient manner possible. The first stage in this progression is using isometrics. Isometric exercises are a great introductory way to start building strength and load tolerance of the patellar tendon since they don't involve any actual motion at the knee joint and they generally don't stress the tendon as much and they're less irritable than other types of more dynamic exercise. Isometric exercises that we often use are things like wall sits, isometric expander squats, and isometric single leg extensions. To make these exercises easier, you can do them in less amounts of knee bend or with less external loading. To make these exercises harder, you can do them with more amounts of knee bend or more external loading. We typically program these exercises for 3 to 5 sets of 30 to 45 second holds 1 to 3 times a day. The second stage in this progression is heavy slow resistance training. This stage utilizes different knee dominant movement patterns that are done with intentionally slow tempos. These are a great next step after the isometrics because we're now increasing the rate of loading but keeping it relatively low overall compared to other types of exercise. We often use different types of squat variations, split squat variations, and leg extension variations during the heavy slow resistance training phase. If you want to make these exercises harder, you can do this in a number of different ways. First, you can simply increase the amount of load or resistance for these exercises. Secondly, you can change the mechanics of the movements by encouraging more forward knee travel, which will allow for more knee bending, which will naturally increase the overall loading and stress on the patellar tendon and the knee joint as a whole. Lastly, you can also progress the tempo during this phase. For example, you can start with a 5-0-5 tempo squat and progress to a 3-0-3 tempo squat over time. This will result in an increase in both the rate of loading and the amount of loading as you'll be able to handle heavier weights with the slightly faster tempos. We typically program these exercises for 3 to 4 sets of 6 to 15 reps 2 to 3 times a week. We usually start with lower volumes, lower intensities, and slower tempos, and gradually progress to higher volumes, higher intensities, and slightly faster tempos throughout this phase of the rehab process. The last stage in this exercise progression is energy storage and release focused exercises. These types of exercises generally utilize little to no external loading, but focus on high rates of loading and are often the most aggravating type of exercise for patellar tendinopathy. And this is why we have these exercises as the last stage in this exercise progression. We generally recommend starting with deceleration only drills such as depth drops, and then progressing to full plyometric activities like counter movement jumps, box jumps, and depth jumps over time. We generally program these types of exercises for 3 sets of anywhere from 3 to 10 reps depending upon the exercise, about twice per week. If you do general strength training or powerlifting style training, you might not actually have to progress all the way to these energy storage and release type exercises because your type of training doesn't have a lot of plyometric demand. However, if you train in CrossFit, Olympic weightlifting, running, or other field sports, then you would want to incorporate these types of exercises since your training does have a much higher level of plyometric demand to it. And the third and final step of fixing patellar tendinopathy is slowly progressing back to your normal, non-modified style of training. For instance, if you were doing slow tempo box squats in the first phase of modifying your training, you might switch to regular speed box squats, then to full range of motion tempo squats, and then finally to full range of motion regular speed squats over time. It's also important to note that these 3 steps don't happen in an isolated nature sequentially, but rather they are all happening at one period of time with more or less emphasis depending upon where you are in the rehab process. If you found this to be helpful, please hit that like button, leave any questions that you might have in the comments below so we can answer them, and don't forget to subscribe to our channel for more content just like this in the future.